Good afternoon, all. Thank you for showing up. Thank you for attending our webinar. My name is Brother IND Valines with the Towson Catonsville Alumni Association of Kappa Alpha Psi Fraternity Incorporated, and we're here to bring you important information about health and wellness. We have some extremely hardworking doctors with us to bring you some timely information, but before that, you're probably asking, who are we? We're Towson Catonsville Alumni Association. The fundamental purpose of our organization is to promote achievement in every field of human endeavor. And the Towson Catonsville Alumni Association is also the newest addition to the Eastern Province of Kappa Alpha Psi Fraternity Incorporated. Before starting this webinar, we would like to acknowledge our regional leadership, Brother Province Polemark Charles Exum, and open the floor up to him for a few words.
Good afternoon, everyone, and thanks to the Towson Catonsville Alumni Association for having me. I believe that the COVID-19 and mental health is very important these days. It is critical that we address this need, as we know that this pandemic has been tough on our community. You know, as a matter of fact, we have just appointed a mental health component at the Eastern Province level as well. And that's how we feel so strongly about this initiative that you guys are undertaking. But on behalf of the brothers of Eastern Province, thank you for allowing me to be here to participate. And where fraternalism happens is key, but more importantly, our service to the community, what you guys are doing. And I want to congratulate you on putting on this webinar. I think it's gonna be some good information. I plan to get some more information so that we continue to educate ourselves and make sure that we stay informed and that we continue to be of service to those around us. So again, on behalf of the brothers of Eastern Province, thanks for having me, and I look forward to a successful and productive webinar.
Thank you so much for your support, Brother Province Polemark. As we begin this informational, I'll explain the housekeeping measures. During this webinar, all mics will be muted in order to allow the speakers to get all of their information out. If you have any questions, please put them in the Q&A panel. So if you look down at the bottom of your screen, you'll see Q&A. Please put the questions in the Q&A panel, and I'll make sure that the questions are presented to the speakers later in the webinar. I'll be making sure that the questions are grouped together to avoid repeat questions. There will be a section later in the webinar where we will dispense those questions to the doctors and allow them to actually answer you. If you want a question asked anonymously, there is a box when you type your question to submit anonymously. And if you don't care, your name will show up. We'll be releasing their contact information at the end if you feel more comfortable contacting them directly. So now that we got that out the way, let me bring the doctors to the forefront. First up, we have Dr. Marius I. Chikura. Dr. Marius I. Chikura is from Baltimore, Maryland, but currently resides in North Carolina. He attended Eastern Technical High School in Baltimore and was enrolled in an allied health magnet program to get early exposure to the medical field. He also played JV and varsity basketball during his time there. He graduated as a top 10 student in his class and went on to attend the college at UMBC, University of Maryland, Baltimore County. There, he earned his undergraduate degree in biological sciences, which is also where he became a member of the Theta Chi chapter of Kappa Alpha Psi Fraternity Incorporated. He then went on to obtain his medical degree at Howard University College of Medicine in 2018. He is currently a senior internal medicine resident physician at Duke, and upon completion this June, will be starting his cardiology training at the Hospital of the University of Pennsylvania. He currently serves as the president of Duke's Minority House Staff Association and as a representative on the Ethics Committee of Duke University Hospital. He is most proud of receiving the 2017 NMA Emerging Scholar Award, the highest honor presented to a medical student by the National Medical Association for outstanding academic achievement, leadership, and potential for distinguished contributions to medicine. He has also valued the principle of paying it forward while prioritizing mentorship for underrepresented students, advocacy for underdeserved patient populations, and the promotion of diversity in medicine as pillars of focus over the course of his educational and professional career. So bringing to the stage, Dr. Marius I. Chikura.
Hey, good afternoon, brothers all. It's definitely a pleasure to be here speaking with everybody today, and I appreciate the kind introduction, good brother. Um, as stated, I'm a Baltimore native myself, currently reside in North Carolina, and there's definitely stark differences in populations from where I came from and where I'm at now. But I think the common goal is really to make sure everybody's well informed and educated. And the purpose of me talking to you today is really to break down the vaccine, the myths, the realities of it, the the logistics of what it's all about. And really, again, my goal is to make sure people are educated and well informed to make decisions that are best for them. I'm not here to tell you what to do. I'm not here to, tell you you're a bad person for making one decision versus another. I just want you to make a decision based off of accurate and legitimate information. So to start, we all have heard the term COVID-19. One thing that's very much misconstrued in the information out there, especially on the media, surprisingly, is that there's not really a breakdown of what that term actually means and what this virus is versus the disease itself. So my goal is to kind of break that down to the basic level. SARS-CoV-2 is the virus. Okay. SARS-CoV-2 is what people get infected with. And when people are infected with SARS-CoV-2, they can go on to develop the disease, the clinical disease, which is COVID-19. Now, people have not really made a sharp distinction between those two entities, but it's actually highly important when we start talking about the vaccines and the numbers. And I'm going to break that down to you to understand what those numbers mean. So to make it analogous and more tangible for what people do kind of understand what's been around for a while, I like to equate it to HIV and AIDS. HIV is a virus, right? People can get infected with HIV, but people live healthy lives, actually sometimes even, higher lifespans if they don't have other comorbidities like hypertension, heart problems, whatever it may be, because they never developed the clinical disease that is AIDS, which is a syndrome. Um, and AIDS is what kills people, right? Because you get opportunistic infections and complications down the road. But if you have HIV, take your meds, you can actually have the virus suppressed in a state where it's not affecting your body. That's analogous to COVID-19 and SARS-CoV-2. SARS-CoV-2 is the virus that you can become infected with, but you don't have COVID-19, which is the disease, until you exhibit symptoms, that being coughing, sneezing, developing fevers, body aches, chills, loss of appetite, anosmia, which is losing your sense of smell, losing your sense of taste, diarrhea, chest pain, you name it, shortness of breath. The disease itself is what happens when you have that constellation of symptoms. And essentially that's because your body is mounting an immune response to the virus. The virus is replicating to a point where it's out of proportion that your body can actually keep under a blanket, and your body's immune response to it is actually what you feel when you're sick. So those two entities are very important to make a distinction between. Again, SARS-CoV-2 is the virus, COVID-19 is a disease that the virus causes. Now, to jump straight into it, the vaccines. The vaccines, there's three major ones out there right now in the market here in the US. You have the Moderna vaccine, you have the Pfizer vaccine, and then you have the Johnson & Johnson, which has been released a little later. Now, the idea behind these vaccines is to help build immunity to the virus. And really it's immunity against the disease. Again, there's a lot of misnomers out there, and I want to make sure people understand what each term actually means. The vaccine itself, the idea behind it is the technology is mRNA technology. I think at some point we all had to take biology classes somewhere along your educational career, no matter what you did. So the term mRNA, DNA, protein transcription, all of that is probably, unless you stay in the health field, it's probably long gone out of your memory. But the way it works, you have mRNA, it codes for a specific protein that your body is able to construct based off of the code. It's almost like a genetic code, codes for a protein that your body makes in the cells. Now, these vaccines contain mRNA that codes for a specific protein that the virus produces, that being the spike protein. Okay, this is not one of the typical classic vaccines that introduces your body to the actual virus, whether it's dead or alive. We have vaccines that have done that in the past. This is not that type of vaccine. This is a different technology. And to also bust the myth that's out there, this is not new technology, as in it was just discovered this year. They've actually been working on this technology for, I believe, at least 10 years. It's been around for a while in terms of them actually working on it, but they haven't actually implemented it until this pandemic, because they needed something that was going to be more efficacious and and more released more quickly, so we can actually get a hold on this, because COVID was wiping out people at an astronomical rate. So this technology, the mRNA technology, again, the vaccine itself contains a code that codes for a protein that's on the actual virus, okay? And when your body produces that protein that the vaccine is coding for, your body's gonna produce the protein, and your body recognizes that protein as foreign. So once your body recognizes the protein as foreign, it starts to attack it. The natural immune system responds to anything that's injected into your body, or anything that's really your body's exposed to as foreign. It's gonna try to fight it, and try to not only fight it to beat it, but also develop a memory to that, what we call pathogen, antigen, whatever it is that your body's not, that's not innate to your body. Your body will not only attack it, but develop a memory against it, so that if it's exposed to that same antigen again, it's able to mount not only a quicker response, but a more efficacious response to help prevent the infection or whatever the pathogen is from, spreading like wildfire. So when this vaccine is injected into your arm, which is the common site, so one of your deltoids, left or right, that code is taken up by your cells, it produces the protein, and your body builds that response against it. Now, when you start to experience what we call the side effects of the vaccine, again, another misnomer, they're not side effects. Side effects are typically thought of as adverse type of reactions to something that's not expected. Everything that happens to the vaccine, for the most part, is expected. These are expected immune responses to something foreign that's in your body. And that being the most immediate, for sure, common response that people have to the vaccine is pain at the injection site, because your body's recruiting an immune response to where the vaccine was injected. Now, people also experience headaches, maybe low-grade fever, maybe body ache, just feeling, crummy for maybe 24 to 36 hours. At most, 48 hours is the longest I've heard of. But somebody might have something else going on, and they blame it on the vaccine. I'll tell you more about that too. But again, after most commonly it's 18 to 36 hours. That's it. The response that your body has been mounted to this peak. Things start to subdue, and most people recover and feel fine. Also recommend people take Tylenol if they start to develop, those expected responses to the point where they feel uncomfortable. Now, after you get that dose, and really it's the Moderna and Pfizer are 2-shot regimens. The Johnson & Johnson's 1 shot. But after you get your full vaccination within you, and they say you're not fully vaccinated until about 2 to 3 weeks after each vaccine series, whether it's 2 shots or you get 1 shot, you won't have the full immunity till about 2 to 3 weeks after that. Then we say you've built the proper immunity to COVID-19. Okay, and let me tell you what that means. Now, we have numbers out there. You'll see these statistics, 94.1, 95%, 67, 85. This is what these numbers mean. So Moderna vaccine is 94.1% effective at preventing mild to moderate COVID-19. The Pfizer vaccine is 95% effective at preventing mild to moderate COVID-19. Both of these vaccines are 100% effective at preventing severe COVID-19. Let me explain the difference between the two. Mild to moderate COVID-19 is what, again, you're affected by SARS-CoV-2, that's the virus. You go on to develop symptoms and the clinical disease, that's COVID-19. Mild to moderate is where you have the symptoms, but you don't necessarily have to be hospitalized. We say, you start developing severe disease when you start having end organ failure, where you need to be hospitalized, whether it's lung failure to the point you need to go to the hospital and get oxygen, whether it's kidney failure because you're having, kidney issues directly from the virus, or secondary issues because you're so dehydrated. A lot of people get very dehydrated. They have diarrhea, which dehydrates you. Your body's losing volume and fluid. That can all cause you to have kidney injury as well. Some people have heart issues, whether it's viral pericarditis, inflammation of the heart lining, or some people have palpitations. They have tachycardia, which means your heart is beating very fast. It can cause you to have arrhythmias, which means abnormal heart rhythms. All these things can be caused by COVID-19, the disease itself. Okay. Now, to go back to the numbers, 94.1 to 95% of those 2 vaccines at preventing mild to moderate, meaning that's the sickness that you have when you're able to stay at home. You're able to, you feel crummy, you have the symptoms, but you don't have to be hospitalized. That's pretty effective at preventing that. Now, both of these vaccines are 100% effective. They've been proven to be 100% effective at preventing severe COVID-19. Severe COVID-19 being that which hospitalizes people, that which causes organ failure, that which kills people. Severe COVID-19 is what kills people. That's what causes death, especially in the hospital setting with other complications. That's what we're trying to prevent. Okay, we don't want people to die anymore from COVID-19, which is why that 100% efficacy against severe COVID-19 is the mainstay. That's what people's attention has been drawn to. Okay, Johnson & Johnson, to give you those same two figures but different numbers, Johnson & Johnson has been proven to be 67% effective at preventing mild to moderate COVID-19, but then about 85 to 87% effective at preventing severe COVID-19. Again, huge difference in preventing what we've seen to cause people to die across the world. This is a global thing, right? So the logic behind, getting the vaccine versus not getting the vaccine, it all depends on risk aversion, right? We're trying to mitigate risk. At the end of the day, you can say you don't want to get the vaccine and you'll take your chances. And that's legitimately what you're doing. You're rolling dice. You're hoping that, one, you don't get infected. Two, if you do get infected, you're hoping that you develop only mild to moderate COVID-19, or actually you're hoping you don't develop disease at all. Again, you can have what we call asymptomatic infection, where you have SARS-CoV-2, but you don't actually develop COVID-19. You have the virus, right? You're infected, but you don't develop the clinical disease. So you're hoping for that scenario. Or three, you're hoping that if you do develop COVID-19, it's mild to moderate, meaning you can stay at home, quarantine, take your medications, your Tylenol to help to mitigate the symptoms, and then kind of thug it out and make it through the disease process, and you recover. Fourth scenario, you hope that if you do develop, moderate to severe COVID-19, where you have to be hospitalized because you're hypoxic, meaning you don't have enough oxygen readily available to you because of lung injury, or you're having any kind of need for any other escalated supportive therapies that you can't get in the house, you can't get over the counter, where you need to be hospitalized and monitored closely. You're praying that you survive that and get out of that in one piece, right? God forbid, the fifth scenario where you have to go, to the highest level of care, the ICU, intensive care unit, where we see folks, especially seeing even loved ones being intubated, where you have mechanical ventilation, meaning a machine is breathing for you, almost like lung bypass. People end up on ECMO, which is like lung and heart bypass. So you have a machine that's breathing for you and circulating your blood for you because your organs are just so beat up and so destroyed from the virus, the damage that the immune response is having on your organs. You're praying you get out of that alive, okay? And in the case where most people get to that point, they don't. Most people, pass. And it's sad. I've seen many COVID deaths, COVID-related deaths since March last year, and a lot of it was prior to the vaccine being available. But to see it now, in folks who are not vaccinated, it's just extremely sad, because we have ways to prevent that. Now, we have that scenario again where you can survive. You can potentially survive. And again, actually, most people do survive COVID-19. That's something that needs to be put out there. I'm not going to skew the numbers and try to scare folks. Most people do actually survive, but it's rolling dice. You're rolling dice. There's no way to say young, old, healthy or not, who's going to survive. You definitely have a higher chance of not surviving if you have comorbidities, that being diabetes, high blood pressure, any kind of cancer history, any kind of cardiovascular disease or respiratory insults at baseline, or kidney issues. Those can all put you at a high propensity and increase your risk of mortality and morbidity from COVID-19, that being death, which is the one thing you can't come back from. And folks who do survive sometimes they have long-term damage to their organs. We call those long haulers. They have issues, complications where their breathing is just not the same. Their capacity of their lungs just never goes back to normal. Or if it does, it takes several months after they've recovered from the acute clinical syndrome. Or they have heart issues, heart problems, liver, kidney, any organ. We've seen all organs be affected by this disease. Again, this is one bucket where we talk about taking the chances, not getting the vaccine, trying to build natural immunity if you survive, and going about life after that. Versus the second scenario where you can receive the vaccine, and we have hard statistics and data stating that one, you not only have 100% efficacy. Thus far, it's been shown since the trials that were conducted back in early summer of last year that you will not develop severe COVID-19 to the point where you need to be hospitalized and the life supportive machines, medications, and have that higher risk of death, right? That's proven by these vaccines. You take that and develop immunity via the vaccine, and you're not rolling dice in that sense. This is statistics, they're numbers, okay? You have this scenario from the vaccines, we develop immunity that way versus immunity naturally. And it's really like you take your pick. And the way you need to take your pick is based off of what's best for you with the proper information. Now, they do say that there's trials out there where they're still trying to study, folks who have certain conditions and certain autoimmune conditions and whatnot, other comorbidities where they're not certain, if the vaccine is recommended for them. But in most cases, including pregnant women and soon to be children less than 15, 16, they're going to clear the vaccine for everybody with trials, again, statistics to prove that. To give you a personal anecdote, I myself had COVID-19. I had COVID back in it was the end of May, early June. It was actually the same week of the George Floyd incident. Just a terrible week. And I was out. I was pretty sick. It's actually the sickest I've ever been in my life. I had mild to moderate disease. Mind you, I have no medical history. I have no conditions. But I was very sick. I had fevers. I had a headache from hell, the worst headache I've ever felt in my life. I lost 10 pounds in a week because of lack of appetite. I've never experienced that in my life either. And just felt very weak and fatigued. I was probably pretty sick for about 6 to 7 days. And I recovered, thankfully. But I'm what they would call a long hauler, or I was at least. When I recovered in June to September, it was actually through October, I had a significant amount of shortness of breath. And I had a faster heart rate than my baseline, which is very troublesome. It was making it hard for me to get around at work and even work out. It was just very difficult. And I tell people, 1,000 times over, and I myself have been vaccinated. I've taken the Pfizer vaccine, both doses, back early this year, January, February. And again, I'll be frank, I had this expected response. I had a slight headache, I had a low-grade fever, took some Tylenol, went to sleep, woke up, and I was fine. That's maybe 18 hours max time to experience anything. Now, being somebody that's been on both sides of the coin, had COVID-19 actual clinical disease and got the vaccine, if I could do it all over again and actually have a choice in the matter and take a pick, if the vaccine was available for me last year in March, I would have taken it immediately. To not have to go through what I went through with COVID and roll the dice. I was in the position where I was scared to go to sleep at night. There's a reported resident who was training a Caucasian man in Michigan, I believe, a facial surgeon who came into the hospital. This is at the beginning of the pandemic. Came into the hospital because he wasn't feeling well, was having diarrhea at home, a little bit of a fever. Healthy guy, 30-year-old, just had a baby with his wife, trainee. Came in, he cardiac arrested and died. Tested positive for COVID, and they attributed it to COVID. A guy with no other medical issues in his 30s. I mean, if that doesn't sink and hit home, and that doesn't, instill any fear into you about what this disease can do, I don't know what will. And that's when I had COVID and I heard about that story, I was scared to go to sleep every night. So I wasn't sure if I was going to wake up. There's no way to tell how this can really impact you and your body and your immune system because there's so much variability. And that's where the rolling the dice comes into play, the variability between each of us as human beings, how we're going to respond to this virus and the disease if we develop the disease, versus the vaccine, which is it's a standardized approach. It's a standard method of developing immunity where the numbers are proven. Hundreds of thousands of people in these trials. I mean, that to me is how I kind of break it down to my patients and tell them that they're my loved one, and my loved ones I have had to talk with them, my mother, father. My mother had a lot of hesitancy, and she's a nurse. But after talking to her, everybody's vaccinated now. People I've talked to, some of my pro-fights, my charter members, they're vaccinated. I'm hoping this also provides some information to you to make an educated decision. The one caveat we have, obviously, is the vaccine was just put out this past winter, right? December, under the Emergency Utilization Act, the EUA, which people think, again, this was rushed. It's not FDA approved, X, Y, and Z. No, it's a way for the government to go by their protocols and release it in an emergency situation. It has been tested. It has been run through trials, accurate trials, valid trials, and it's validated. And it's going to be FDA approved. It's just they bypass the process to get it out on the market. If you wait for the FDA approval, thousands, hundreds of thousands, millions of people are going to die while you're going through a process. That's the only reason why it was pushed out under the Emergency Act, not because it's a rushed process and this isn't like a valid vaccine. The vaccine works, the science works, everything behind it is legitimized. So again, you know, I wish I could read people's minds, and when people ask questions, they have a hesitancy. I know there's a lot of mistrust with the medical system based off of history, and that doesn't go, upon my ears. I'm not deaf to that. I have my own questions at times when it comes to science and hard numbers, and going from being on the front lines and seeing folks developing, or developing terrible disease, losing their loved ones, being in the hospital, having to talk to their loved one on their deathbed on an iPad, saying their final goodbyes because of a pandemic like this, where we have now a vaccine that can help mitigate it and slow it down. And it has been. I think it's definitely my duty and the duty of other providers to make sure you make a decision that's best for you, with the accurate information, not misinformation. And there's one more caveat I do want to provide, that being that because this was released, we don't have the data for the long term, the long haul. All right. People always say, well, what about 10 years down the road? Am I going to grow an extra eye on the side of my head because I got this vaccine? Am I going to, lose my fertility? My kid going to be autistic? Like, all the questions. There's no way to foresee what can happen in the future down the road because this is a new vaccine, right? So we have to kind of watch and wait and see what happens from this cohort that's receiving the vaccine down the road. But I will say, this has also been clinically proven, within the first several months to year, if nobody's had any issues with the vaccine, then it's likely going to be fine. And also, you have to put into perspective, again, do you want to roll the dice and take your chances now with the virus and hope that you survive and develop immunity that way? Which that immunity is also variable. That's another topic that I want to go into, but we can talk about it if we have time. Versus get the vaccine and you know exactly what you're dealing with. So that's my piece. I really appreciate the opportunity to talk to you today. I'm happy to answer any questions as we move along. But again, try to make the proper decisions based off of accurate information and do your reading and your research. Don't hesitate to ask your medical providers, not the self-proclaimed Google providers, the Google doctors who propagate myths and have their own agenda and scaring the public with misinformation. So thank you.
Thank you so much, Dr. Chikura. Everybody give him a virtual round of applause. We really, really appreciate all the information, the time, and just the guidance that you've given us. So we really, really thank you for that. Moving forward now. Oh, sorry. Before we move forward, I want to reiterate this question and answer portal. If you have any questions, please direct them to the question and answer panel feature, so I can see it. And once we get to that question and answer section, I can ask it. We do have somebody figured out the anonymous attendee. So if you need to ask your question, but you don't want your name put out there, all you have to do is click send anonymously and nobody will ever know. But we want to get these questions out to the doctor so we can get the right information. All right. Coming up next to the stage, we have Dr. Shedrick Mccall. Dr. Shedrick Mccall is an associate tenured professor of psychology at Virginia State University and a forensic psychologist at Central State Hospital. Dr. Mccall has a BA in psychology, Maryville College, a master's in counseling from Liberty University, special education classes at Virginia Union University, guidance counseling at Lincoln Memorial University, and a EDD in counseling psychology from Argosy University American School of Professional Psychology. Dr. Mccall has worked as a juvenile psychologist and clinician for incarcerated youth and people with mental health illnesses. Dr. Mccall has received many professional, athletic, and academic awards. Dr. Mccall has over 50 publications, and he has co-authored a psychology textbook. Introduction to Psychology Guiding Young Minds is the name. Dr. McCall has been in the education, corrections, and mental health field for over 25 years. His research interests are studying mental illnesses in the African American community and the school to prison pipeline controversy. Finally, he is married to Dr. Shannon McCall, and they have two children, Shedrick III, who is 22, and Madison, who is 5. So, coming to the stage, Dr. Shedrick McCall.
Thank you, good brother. Thank you. And it's an honor to be on here today and to share some information from a mental health side. I think that everything coincides and go together since we've had the COVID-19. There's been a lot of physiological aspects to COVID-19, as the good doctor indicated. But I wanted to talk about the sociological as well as the psychological factors that are currently affecting many people. This COVID-19 has affected approximately 33 million people and approximately 585,000 deaths. That's a lot of mothers. That's a lot of fathers. That's a lot of grandmothers. That's a lot of grandfathers. That's a lot of brothers and sisters. So losing that many people is definitely going to have an impact on your mental health stability. For some, it's going to take your mental health from stable to unstable. So I just want to talk to you all about the ramifications of mental health. As a good brother indicated, I've been in the field for over 25 years and definitely enjoy what I do. And, COVID has, for me, I've been fortunate to have a lot of work and be able to speak from a mental health standpoint because a lot of people are experiencing so much. We have an increase in depression, an increase in anxiety. People are having crying spells, sad spells. There's a lot of isolation. People are isolating themselves, which exacerbates depression and anxiety and bipolar and all those things. But people are isolating themselves because they're afraid, to be around others, especially in the beginning of COVID when things to us were unknown. And I think that anxiety dealing with that unknown, it turned an irrational fear into a rational fear. And many of us, we were really concerned, not only about ourselves, but we was concerned about our families. Many of us had our parents, our grandparents. We didn't want to, infect them or affect them at all with COVID. So I just want to kind of talk to you about what is mental health, and the thing I like to tell people is that everybody, 100% of us are going to experience some mental health issues, but not a lot of us are going to experience mental illness where we actually get diagnosed with something. So when we talk about mental health in itself, it's that emotional, that psychological, that sociological well-being that affects us, such as things like, the school, relationships, peer pressures, and it's just our ability to handle stress. And we know that stress are those things that exceeds our ability to cope with, because if it didn't exceed our ability to cope with, then it wouldn't be stress. So we know that these have definitely been some stressful times that influence our decisions, our choices, and things like that. So just want to say that this COVID-19 has affected us in ways that our sense of normalcy has really changed. Our lack of ability to be able to interact with our families, as I indicated earlier. For many of our children, they haven't been able to go to school. My daughter started kindergarten, and I was blessed in the sense that her school didn't shut down, but kindergarten is the foundation of her education. And I think to do that online is not necessarily the best thing for our children. It affected our children as far as school, the socialization aspect. A lot of our kids, they socialize at school, so not having that affected their mental stability. You're not able to go to church. People were not able to go to work. People got laid off. So when we look at that sense of normalcy, those are a lot of things that affected us, not being able to go to restaurants, not being able to go to the stores, not being able to visit family. All of these things have played a part on our psyche, and it affected us. For some of us, even when we got sick and it wasn't COVID or it was something else, many of us in the beginning were even afraid to go to the hospitals because the hospitals was dealing with so many people with COVID-19, and we just didn't want to go there because we didn't know if that was a safe environment for us. So just dealing with our health, dealing with death, as I indicated earlier, and dealing with that unknown has definitely affected us from a mental health standpoint. Um, when we talk about mental illness, COVID itself has exacerbated people's mental illness. It's affected their mood, it's affected their thinking, and definitely affected their behavior. And we know that. Some of the ways that that you may have been affected, just from a psychological standpoint, is if you was withdrawing from people, sadness for an extended period of time. From a diagnostic criteria, when we speak of sadness, we're talking about individuals who experience it for usually over 2 weeks, crying spells, things of that nature. So we know that this isolation and being to ourselves and dealing with this unknown has exacerbated some of those symptoms. It correlates with us being diagnosed with depression, bipolar, anxiety, and as I stated, it also exacerbates those things. And I was just telling you some of the symptomology that's associated with it. Again, sadness, withdrawal. People had suicidal thoughts. Some had decrease and increase in eating. Some people during COVID stayed at home and ate a lot. Some people didn't. Some people stayed at home. They slept a lot. Some people didn't sleep. But these are a lot of the symptomologies that are associated with COVID-19 and mental health. Um, you know, with trying to deal with this, it affected our relationships. It affected our jobs. There were so many people, unfortunately, was getting laid off. And, when people was getting laid off, it affected their psyche because they were not able to provide for their families. And this has been a trying time for most of us. One of the things that I always like to talk about with an audience, especially of Black males, is that a lot of times as men, when things exceed our ability to cope with, a lot of times we self-medicate through alcohol, through drugs, believe it or not, through anger and aggression. So many of us, we don't see the value in talking to a psychologist like myself, a therapist, a counselor. But I think that's very important because I always tell people, if you can't help yourself, if you can't get yourself straight, then you can't help anybody else. So you're not seen as weak. You're not seen as bad. Many of us need help, and we need to talk to people, professional people that can systematically help us reach a teleological point, systematically help us deal with anxiety, our depression, and they're able to psychologize with us. So many of us need help so we don't self-medicate and hurt ourselves and hurt our family members in the process. So some of the things that when people was coming to me, Dr. McCall, what can I do in these situations? Just kind of 5 steps I tell people. I said, first, just kind of pause and take a breath and just understand what's going on. I think that a lot of people were overwhelmed with emotions in the beginning. Again, I associate that with the unknown in the beginning. I think things are coming back a little bit to a sense of normalcy. But I remember, I wasn't going to shake anybody's hand. It wasn't going to hug anybody. And some of us, even in the fraternity, that's the way we greet each other, by the grip. So when you're not able to do those things, it definitely can affect your psyche. Again, some of the things you can do, as I indicated, one is just pause and breathe and just find out what's going on. Social media was a monster that could help you and hurt you, because there was a lot of conspiracy theories on there about COVID-19. And if you believe in those things, then it definitely could affect you mentally. As the good doctor indicated, even when people are deciding whether or not to get vaccinated because of their mental health and the things that they've heard, it affects their current decision-making regarding whether they want to take the vaccine or not. I have taken the Moderna vaccine and I'm fully vaccinated, didn't have any side effects. Another thing that I advise people to do is take care of their body. I know that when the allergies came around and sinuses, a lot of people, the same symptoms that kind of was with the allergies or with the COVID and stuff like that. So people got nervous and anxious about those things. So I tell people, really take time and understand your body and understand what's going on with you and educate yourself about COVID-19. And I think in educating yourself, that would also decrease some of the anxiety that you experience surrounding COVID-19. Reach out to people, stay connected. as I indicated, that sometimes I say Black people, we're loving people, and when you couldn't touch your grandmother, hug your grandmother, kiss your grandmother for fear that you may pass on something because you asymptomatic, it's time that we reach out. We could FaceTime. People was doing drive-by birthdays, and person stand on the porch and you drive by without touching anyone. You could send letters. This is a good time to get our skills up in writing. Email people, phone calls, texts. Just reach out and keep your situation as normal as possible. I tell families to sit down inside the house and have Sunday dinners and have dinners at night. And for the children who experience anxiety and really didn't know what was going on with the COVID, you think about it, one day in March, you going to school in January, you're going to school in February, you start hearing this chitter chatter about COVID-19, and then they just shut everything down, which was probably the right thing to do. But you look at the impact that had on people. Children lost their ability to socialize. They lost that human touch and that interaction with their teachers. There's just so much that COVID affected us from a mental health standpoint. And I think some people don't even realize how much it did and has affected us from a mental health standpoint. So take a pause, take a break, take care of your body, reach out to people. And finally, I tell people that seek help, whether that's physiological help, whether that's psychological help or socialization. These are the things that we need to do, to help us and keep our mental stability and keep us able to interact and, do the best we can. And I look at this, the post-COVID syndrome. How are we going to interact with people now that it appears that, things are calming down a lot, and that the vaccine is helping us a lot. So now we'd like to see how people begin to interact again. I've been in some places as far as coaching and things like that. And I think that people are happy to be back to somewhat a sense of normalcy. So I just want to let you all know that mental health is real, that, people do have issues and bouts with depression, where they isolate themselves, where they're sad, where they have crying spells, and to the extent, unfortunately, that people become suicidal. And I tell everybody that if someone becomes suicidal, take it seriously. Even if you feel like it's a cry for help, take it seriously, because a lot of times people attempt things, they cut their wrist, they take pills, and they may attempt it in a sense to get attention, but sometimes those things don't go as we plan. So take all those things seriously, and understand that mental health is real, that people during this COVID, again, I can reiterate several times, lost jobs, lost homes, lost family members. And it's been tough. Some people are not able to get their jobs back. So, this has really affected us. It's affected relationships. So I just want you to know that it is real, and that if you have any symptomologies, if you have any of them that I named, and there's a lot of risk factors out there. So if you have any of them, then I advise you to seek professional help from someone that can sit down with you and create an atmosphere that's conducive for you to talk to them about your problems, so that they can help you get better psychologically and mentally and emotionally, because it is a lot that's going on. And we know that the percentage of individuals experiencing mental health has skyrocketed since March of 2020, when COVID seemed to really take a rise. And as I stated earlier, 33 million people, approximately 33 million people has been diagnosed with it. But that number of 585,000 deaths, that is a lot of deaths. And that's Christmases where people didn't have their family members. There's Thanksgivings where people didn't have their family members. We just had Mother's Day, and we got Father's Day coming up. So we have to think about a lot of those things. And we have to prepare ourselves from a mental health standpoint. And I say this in closing, and I love for you all to ask a lot of questions if you have. We got to find a way to take care of ourselves. What can you do to take care of yourself? Whether that's exercising, nutrition, reading, whatever you have to do to make sure that your mental health is straight, so that you can take care of your family and that you can be okay for yourself. Make sure that you seek that help, whether it's from a professional or just talking to a support group, whatever you need to do. And, so this is definitely things that we have to look at. So I would say you are, again, mental health is real. mental health can lead to physiological, physiological things such as, digestive system, headaches, back pain, things like that. So it can become real. And I just want to thank you, brothers, for allowing me the opportunity to share a little bit with you all. And I hope that this information has been informational, and I hope that you've learned something from it. And I just look forward to the questions and answers. Thank you so much.
Woo! That was good. That was really good. Everybody give Dr. McCall a big round of applause, virtual round of applause.
Thank you,
Once
bro.
again, the questions are starting to pour in, and we are very, very grateful. I'm gonna give you a couple more minutes to get your last couple questions in. As we're having this discussion, and I'm giving the questions to the doctors. You can continue to roll the questions out, but we're getting ready to start this question and answer portion. We have some really, really good questions for the doctors. Doctors, I hope you're ready, because the people want to know. The people want to know. Now, the questions can be answered by either doctor, and from what I'm going to try and do is, as these questions are answered, I will start trying to clean up the question and answer panel. So don't be dismayed if you start seeing that these questions are going down. That's because they're getting answered. So first question, how do I know that I'm 100% cured if I get the vaccine?
So I think 100% cured. I don't know if the question was actually worded that way. I think it's just cured from the COVID-19 disease, because the vaccine doesn't cure you.
Sorry, real quick. It says, how do you know when you are 100% cured? Thank God you were able to recover and heal from this critical, deadly COVID-19. How do you know when you're 100% cured?
Okay. So basically, the way that you know you're cured from, or it's really, again, it's not cured, recovered is probably the more appropriate term to say. And that's when you have, had not had symptoms. They actually, I don't know if they've updated what the guidelines are, but at least back when COVID was in the heart of the pandemic, it used to be when you didn't have symptoms for 72 hours and you had finished your quarantine period, that being 10 to 14 days. It's fluctuated some places, but at that point, they said you're actually cured, or you have recovered from COVID-19, you're able to resume normal activity. But it's really the vaccine, to kind of go back on it. I don't think this was a question that was asked, but I think it's also good to address this. The vaccine does not cure you, in any way if you have the disease. This is a more preventative measure. It's primary prevention. That being, you get the vaccine, it almost puts a blanket over you, like a primary defense, so that if you do get exposed to the virus, you don't go on to develop, significant disease. And definitely the disease that's going to kill you. If you do develop disease, you have that 5% chance of developing it versus a lot higher variability if you are not vaccinated without that immunity, and then you contract the virus itself. So that's the thought process.
Okay. Thank you. Next question. If you have already had COVID-19 and recovered, how protected are you from contracting it again or contracting variants?
So I guess this is in the context of having not had the vaccine. I can answer it in the context of not having the vaccine and having gotten the vaccine. So again, if you have not gotten the vaccine, then, and you get COVID and you recover from COVID, then in some sense of the word, you have your body's built immunity to the virus, to the disease. So you're somewhat protected natural immunity, but there's no way to say how protected you are. And that's, again, part I'm talking about when I say rolling dice, taking a gamble, and going based upon the variability that we have from person to person. If I had COVID and the next person had COVID, we both recover, there's no way to say if we had the same amount of immunity from getting it again, and what those numbers look like, what percentage there is. that being said, more times than not, if you have a strong functioning immune system that's not compromised in any way, and you recover from a virus and the clinical syndrome that it causes the disease, then you will have some immunity against it. Most people, that's why they say most people who got infected with COVID, very small chances that they'll develop COVID again. Very small chance because of that immunity they build. But it's all variability. Again, you're rolling dice taking the chance versus the vaccine. Even if you've had the infection and recovered, the vaccine still provides you guaranteed immunity. So that's the thought process behind it. There's no way to give you a number or say how likely you are. Specifically, I will say the likelihood is low in general, but again, that's not concrete to say for everybody.
So thank you for that. We have two questions that are relatively similar. So I'm gonna group them together. People who have been fully vaccinated are still being diagnosed with COVID again. Can you pass this on even though you're fully vaccinated? And has anyone died or suffered any severe adverse effects after being fully vaccinated?
Yeah, so again, this is also, I think, some misinformation out there where people have COVID, they recover, they get tested again within a certain time period, and they test positive again, and they say it's a new infection, reinfection. That's just not truly a new infection. And this is the reason why a lot of the times, I have to go back and brush up on, because they change it. This is an ever-changing dynamic, pandemic we're living through. So as we get more information, we update what's out there. But the most recent information that's been put out to me, is that they don't recommend retesting you for COVID-19 within 60 to 90 days, because you may still test positive and not have actual clinical disease, or not have an actual current infection, if that makes sense. Definitely not immediately after. Say you finish your 14-day quarantine period and then you wait 2 weeks and get tested again and you test positive. There's no way to say that is an active current infection or a new infection. If anything, because they say that there's dead virus that actually can live in your nasal passages, in your respiratory airways, that can still be detected by the test, the PCR, and come up as positive genetic material, but it doesn't mean the virus is alive. So people that get like routinely screened for COVID because their job or area of employment, and they actually have recovered from COVID within the last 1 month, they may still test positive. It doesn't mean that they have a new infection or they're still currently infected. So that's something to be mindful of. In terms of long-term adverse effects, or I guess serious adverse effects from the vaccine, I think that was the other part of the question.
You died or suffered any severe adverse effects after receiving either the first or second dose?
So nobody has died from the vaccine itself. They have said that, again, people develop responses to the vaccine that are expected. Your immune system generating responses to build immunity. But people do have what's called anaphylaxis. They can. And the anaphylaxis is basically hyper exaggerated immune response, almost like an allergic reaction, if you will, to something foreign to your body, or something your body recognizes that causes your immune system to rev up in a way where you have an exaggerated immune response. And that itself can be dangerous for people. That can hospitalize people. And when I say hospitalized, again, it's a temporary thing. It's not like a hospitalization where you're sick for a prolonged period of time. You just need to come to the hospital, get steroids, get an EpiPen. Like, it's the same thing. So primary example, people have shellfish allergies. People have, they're allergic to certain dyes or peanuts. And they have anaphylactic reactions, hypersensitive to whatever they're being exposed to. That can cause your airway to swell. It can cause your eyes to get puffy. It can cause you to get hives. Your blood pressure can drop really low. All that stuff can be dangerous and can cause you to, potentially have a life-threatening situation if you don't address it with the right way. That being with steroids, EpiPen, whatever you need to do, fluids to mitigate your response, Benadryl in some cases, that people can have to the vaccine, and that's a real thing. But that's known across the spectrum for all vaccines. They typically say if you have anaphylaxis to one vaccine, if you've had a history of an anaphylactic reaction, severe allergic reaction to a component, in a previous vaccine, then they say you should definitely discuss with your primary care provider, or be monitored. If you want to proceed with the vaccine, be monitored closely when you do receive the vaccine, because again, it's something that can be mitigated when you have the treatment strategy. But you need to definitely be aware of your medical history with vaccines in the past. And if you don't know, if you never received a vaccine before, some people swore down the flu vaccine, swore down other vaccines, but they're ready to step up and get the COVID vaccine, which is fine. But you should also be monitored. And we routinely monitor people at these vaccine sites for at least 15 minutes after they receive the vaccine, because within that 15 minutes, you'll know if a reaction is starting to rev up. You'll feel funny. You'll start to develop those symptoms that are consistent with the anaphylactic reaction, even if it's a mild allergic reaction. So that should be something that's you be cognizant of if you choose to get the vaccine. But nobody has died directly from results of the vaccine or anything like that.
Now, is it possible that the vaccine can prevent other diseases other than COVID-19? Are there any ongoing studies currently concerning other diseases using the vaccine?
No, there's no other studies that the vaccine is being implemented with in terms of other disease states that can prevent. It's primarily targeted against COVID-19 and preventing that disease. To kind of, this is a point that's not been asked in the question, but I do want to make this point known so folks don't feel like they've been misinformed or not properly informed. This vaccine, I gave you those numbers earlier, about 95% efficacy versus 100% efficacy in severe clinical disease prevention. This is in preventing the disease. You can still get infected with COVID-19. Okay, that's the one caveat that you have to understand. You can carry the virus and be infected, but never develop disease. The vaccine is meant to prevent development of disease. Now, the vaccine itself, not only does it prevent you developing disease, but it prevents you from spreading the virus itself if you somehow do contract and get infected. The way the virus spreads is through spreading of respiratory droplets, what's aerosolized. That being you sneeze, you cough, little droplets kind of spread. And that's what other people inhale into their nasal passages, the oral passages, and they get infected. Because the vaccine, and there's been trials that are still being published. There's articles, studies that have been published, and they're coming out, they're hot on the press now, where they've done studies to show that the vaccine does prevent not only development of disease, but also transmission. And the way the disease itself is transmitted is from the symptoms of disease. The way the virus is transmitted is through the symptoms of disease. So if you just think about it logically, because this vaccine does help mitigate the disease, as in not cause those symptoms, development of disease being development of those symptoms, you can't spread it as readily. So getting the vaccine prevents you from developing disease and spreading the disease, but it does not prevent you from contracting it. You can still have the virus. And that's why people, you don't want to go out there and not have the information, and then somehow, again, your job, wherever you work, may do routine tests just because they want to test you, especially if you're a teacher. I know they might test folks randomly and students. Say you've been fully vaccinated, go and get a test, a swab. You test positive for the virus, SARS-CoV-2. You say, oh, the vaccine didn't work. I'm sick. That's crazy. Why did I get this vaccine if I've still got the virus? Again, you're not sick. You might still get infected with the virus and you carry that, but if it doesn't replicate enough, you don't have that protection, which you get from the vaccine, to cause you to develop disease, then you don't ever develop COVID-19. You just have asymptomatic infection. That's something that people need to be aware of too.
All right, I'm gonna ask one more medical question, and we're gonna transition to the mental health side. Give Dr. Chakura a little bit of a break. What can you tell us about the role politics have played on our community as it relates to this disease?
That's a question. I mean, we can go into different avenues of that, where we start talking about political views and whatnot. But, realistically, this is a country where a lot of things are politicized. And I've actually been in a program here at Duke where we talk to North Carolina senators about Medicaid expansion. And even that topic has been politicized because, there's a partisan type of approach to our nation, right? There has to be two sides. even if people on one side don't agree with the other side, because they're a member of the other side, they can't openly say that they agree with other people. That's just the way this works. And the vaccine itself, I don't know if the vaccine has itself been politicized, but I think the pandemic has been. And the idea of, quarantining versus gradual reopening of states and normalcy of activity, all of that. You'll notice that a lot of red states, do favor getting back to business because of the almighty dollar and trying to, um, you know, basically bypass, the protocols that are in place to get back to that normalcy. And a lot of that's because they do believe that there's a chance that people who are conducting business will be following the CDC guidelines, and this is still America, and there's an ability to have freedom of choice when it comes to how you choose to operate out in public during such a pandemic, whether it's obey the mask mandates, whether they're actually socially distanced, practice that. And on the opposite side, you find a lot of members of the blue states have the conception that they do participate in the mandates and follow them almost more to a T, and there's a little more of a delay getting back to normalcy. I think in either case, irrespective of which side you're on, you have to be realistic and look at the numbers, and the numbers don't lie. Statistics, you can have opinions and views and whatnot, but the numbers themselves, statistics don't lie. You look at the areas where the pandemic's been the worst, people have been hit the worst with the disease. It's typically folks in those areas where they have tried to get back to normalcy quicker than probably is warranted. And I do see, a lot of folks, again, talking about disparities in healthcare, disparities in outcomes and care for our communities that we serve. African Americans, Latinx, I mean, the disparate outcomes speak for themselves as well, and they've only been exacerbated and bolstered by this pandemic because we just don't receive the same type of care. And a lot of folks also don't have the same type of opportunity to receive care itself inherently versus whatever exterior impediments they may have on receiving care. Not to mention we have high rates of comorbidities that kind of talked about before, heart disease, diabetes, you name it, that can put you at a high risk of, potentially developing severe complications, or the most severe complication from developing COVID, which is death. We're just at a disadvantage from the get-go. So I think, you talk about politics and kind of there being two different sides to the vaccine and the pandemic. I think more so with the pandemic, but the vaccine itself, it's hard to say because everybody, look at who's getting it. There's not really a discrepancy in who's getting it, or a big difference. I just think, regardless of what political side you choose, you need to make a decision based off of accurate information, and that's what most folks are doing, hopefully.
So hopefully that answered that question. We're gonna give Dr. Chikura a couple minutes, let him breathe while we move on to Dr. McCall. First question for Dr. McCall: what are some long-term effects of the pandemic mentally? Oh, Dr. McCall, you're muted.
I think some of the long-term effects, dealing with this pandemic could be people. I think people are going to do better with self-care and identifying, kind of what's going on with themselves and their body a lot earlier. I think that when we look at something that may be negative, is just the trust factor. I think that this pandemic has elicited a lot of mistrust in people that, it depends on what you believe in. people believe that these certain conspiracy theories. And so that's going to affect a lot of people long term, just their trust. They'll be more hypervigilant about diseases. I think that from a psychological standpoint, I think that there's going to be a lot of anxiety long term, a lot of depression long term. I think that these things are going to happen for a long time. And I think that people who experience problems with breathing, or they feel like they have symptoms, they may have problems long term with sleeping, as the good doctor indicated. So I think those are some of the fatigue. I think those are some of the long term ramifications. But primarily mentally, just an increase, with depression, anxiety, and things like that long term.
So now, along those same lines, what are some mental cues that we can look for in school age kids, or even adult family members? What are some mental cues that we can look for in order to maybe recognize some of these mental challenges or mental struggles a lot earlier, instead of letting it really sit down, fester, and now it's a little bit out of control?
Right. I think that primarily, kind of starting with children, I think that especially school age children, if they are, isolating, they can have an increase in aggression and bullying. You can watch their sleep patterns, their eating patterns. You can look at their academic performance. If they were a great student and that's decreasing, that's a red flag for you. If they love school, now they're avoiding school, that could be a red flag for you. If they're not interacting with their brothers and their sisters and their family members, definitely could be a red flag for you. If you see them giving away things, if you see them deteriorating in their appearance, where they used to be well groomed and now they don't care about those things and not washing their clothes and things like that, we find that all those could be red flags. On the other side, for adults, it's similar to what I said earlier. Some of the symptoms that you can see in adults is, sadness, withdrawal, if they have suicidal thoughts, homicidal thoughts. Even with children and adults, you got to watch their outbursts, their angry outbursts. You got to look at, of course, the eating patterns. And if you see somebody losing a lot of weight or gaining a lot of weight, that definitely is something you can look at. Their ability to concentrate. So there's just so many things, and of course, if they have any physiological ailments, and also the change in their mood, so those are some of the symptoms and cues we can look for. And if you see those things and you see multiple things from that list, then I would advise you to potentially seek help for that individual, whether it's a child or an adult.
Okay. So this one is specifically for you. How can we support a family member who may not recognize the impact COVID is having on them? Or what might we do if we're worried about somebody that may be going through depression?
Yeah. So the main thing when someone is going through depression and they're exhibiting those symptoms of depression, again, symptoms are very similar. The biggest symptom in depression that really separates major depression from depression. So let me say this: all of us are going to experience some form of depression, but all of us not going to experience diagnosable major depression. And the big thing that determines the difference is suicidal and homicidal thoughts. So if you suicidal or you homicidal, then you lean and it lasts for over 2 weeks and it's affecting your ability to function, then you definitely need to get help. And when we start talking about helping family members, I think the biggest thing is we have to listen to them. We don't need to be as judgmental. We have to hear them out and see, what they think, because they have a voice, they have an opinion. And then we just got to support them. And when the time comes, we have to educate them, so in talking to them, we have to give them some statistics to back up some of the things we're saying. We may need to get them help. They may need physiological or psychological help. And most importantly, just support them and love them and help them understand the severity and the significance of COVID by telling them about the 33 million people that have been diagnosed and the almost 585,000 people that died. So I think just supporting them, giving them a support group, giving them an ear, and just giving them somebody they can talk to and somebody that'll listen to them.
Thank you. Now, this is staying more towards the virus, and then we'll go a little bit more broad into mental health. After having the virus and recovered, does it affect the brain and its functions? Dr. McCall.
Yeah, I would think I've heard when it does affect one's ability. They say they have foggy thoughts. They can't concentrate the same. Some have short-term and long-term memory. So yeah, it definitely has an impact on the brain. But right now, as the good doctor said, it's not been enough research to tell whether or not it's going to have long-term ramifications. But as far as short-term, there have been people with memory loss, short-term and long-term, foggy thoughts and things like that. So definitely, I've heard that there is a correlation with it impacting and affecting one's brain.
Okay. Now, one more for you, Dr. McCall, and then we'll jump back to Dr. Marius. What do you see as, and this is a more general question, what do you see as the possible long range changes and mental health effects on a child who has suffered a loss of a close family member, mother or sister, mother
Yeah, I
and
think,
sister? Sorry.
okay, yeah, most definitely. I think that right now, when we're dealing with children, I think some of the things that's going to happen is that we need to get them better access to mental health care. We need to identify they need it at an early on in the trauma that they are experiencing. So as soon as they lose the mother, as soon as they lose the sister, we need to get them help. A lot of times we sit back and say they're going to be okay, but they're not going to be okay if they don't get that help. So we need to definitely have what I call early intervention. Uh, we need to do grief therapy for these individuals. Kids get angry, they get depressed. They start bargaining. They get in denial. So those are kind of the stages of a grief, and then acceptance. And we say some people are in shock. So I think definitely we need to give them help right away so that they can deal with their losses, because trauma, as it builds up, it definitely can impact one's life in a negative light.
Thank you. Hopefully that answered your question. Back to Dr. Marius real quick. First question: will the young people that haven't been vaccinated remain at risk?
So when you say young people, I kind of need an age range. An age range
Um,
because
there wasn't one, but I'm gonna say the eight. Can I say 18 to 26? Is
sure.
that too broad of a range?
No, that's actually a perfect range to detail a young adult. There's not, and really we call somebody young in the medical world if we say they're still young when they're less than 45, 50, like 50 and below, we still say relatively young. But we do start to see different medical issues that we see as people progress beyond that. Now, I will say, yes, the risk is still there. And that's kind of talking back to the misconception I talked about earlier, where people used to assume, because you're young, healthy, without medical issues, that you can't be touched by this virus, let alone the disease, and have any serious complications. But again, there's a lot of variability out there. We have seen young people be heavily impacted, whether they get the virus and recover, get the virus, develop disease, recover, and they have long-term complications. They fall in that long hauler category. Like I was in, me myself, I'm only 29, and I was a long hauler myself. Versus people who get the disease and die. I told you about the story about that Caucasian resident who cardiac arrested and died, had no health issues. So there's really no way to tell. Again, the proportion of young folks that make up, the people that have serious complications, let alone death, is still very small. You have a higher chance of, you know, surviving, not developing significant clinical disease or issues the younger you are and the healthier you are, right? But that is not absolute. There's no way to tell for sure. Again, it goes back to the same concept I say, are you willing to roll the dice? So that's the way I look at it.
So just to gain some clarification, it was more towards 10 years old, that 8 to 10 year range. Still same outlook.
So no,
Okay.
you know, and this is the reason why you don't see many children or pediatric patients or cases. Like we don't talk about kids getting COVID and dying COVID. You don't hear that in the news and the media because the number is slim to none. Um, to get infected with SARS-CoV-2, yes, they still can be infected. But to develop clinical disease, again, that's the response of your body to the virus, right? As a kid, your immune system is so immature and still developing, you literally don't have the potential to develop that immune response, that body trying to fight off the virus in the same way, in the same manner in which adults or more mature immune systems can. So without the immune response being generated, you don't have the symptoms. You don't have shortness of breath. You don't have heart issues. You don't have GI upset. You just don't have those same things happen. So that's why kids don't really develop COVID-19. Kids, the younger population, especially less than 10 years old, you just don't see that. And it's the same reason why, same thought process as to why we give folks steroids or immunosuppressive agents, things to suppress the immune system when they have COVID-19. I don't know if you've heard dexamethasone, there's other immune suppressive agents, because we want to mitigate the immune response. Your body trying to fight the virus is actually why you get sick. You have white blood cells, you have this immune defense system coming to attack the virus in different locations where the virus is taken up. The virus is taken up in cells, in certain cells or I guess where the receptors are. H2 receptor is what the virus binds to, but that's granular detail. You find that receptor in your lungs, you find it in your GI tract, you find it in your heart muscle. And those are all the primary places where you have symptoms develop because your body is sending its forces, its infiltrate to go to those areas and try to fight the virus. But in doing that, it causes almost like a clogging of those areas, because so many white blood cells come and the immune response comes. That's why people have the lung failure, the heart failure, the GI system upset. You just don't have that development, that maturity of the system at such a young age, which is why kids have a whole separate list of problems that they can have that adults don't have, because their immune system is just different than ours. So less than 10, the risk is very low.
Okay. So that kind of answers, is there an age limit or requirement that a person should be before receiving the vaccine? Can children 12 through 16 receive the vaccine?
Yeah, so they can. And I talked about it earlier. I think they're getting ready to release the guideline that the vaccine is going to be approved for children less than 16 very soon, if not July. Like my little brother is 14, turning 15 this year, and he's going to get the vaccine. Still at a much younger, much lower risk to develop disease and whatnot. But again, nothing's absolute. You know, it's all about taking the chances and taking whatever preventative measures you can, knowing that nothing's 100% guaranteed. So giving yourself the best chances of not developing disease, not having complications. That's the reason why it's promoted, and I'm going to promote it to my little brother and children, definitely of the age to get it.
Well, doctors, I've really, and I feel like I can speak for the collective. We really appreciate your time, your wealth of knowledge, the answers that you've given us. They've answered a lot of very, very important questions. We are running out of time, so we definitely need to set something up to try and get you guys back so we can get some more information. But first, like I said, we want to thank the doctors. We want to thank them for giving us their time and giving us that great information. We want to thank our regional leadership, Brother Province Polmark, Charles Exum, for being on the call. We want to thank our technology team for definitely making sure that all of this was possible. And we want to thank our social action committee for coming up with the idea and executing at such a high level. We appreciate everybody. We appreciate your time, your attendance, and we will definitely be on the lookout for more of these health seminars. And we thank you for making this a success. Thank you, doctors. Thank you all. Have a great night.